country. An international conference will today discuss reports of the atrocities Russia is said to have carried out in Ukraine. The meeting will also debate possible prosecutions. BBC News.
Fan Network News from the BBC. Put meaning into the day. This is Live Talk with Ronak Kotecha, the smooth music mix and the best conversation across the morning. This is Talk 100.3.
12:02, a very good afternoon. Welcome to the second hour of Live Talk with me, Ronak Kotecha. And now on the phone line, we have with us Dr. Shivani Wadhwa. She's from Fakeeh University Hospital. She's a dermatologist and she is joining us right now. Hi, Dr. Shivani. How are you doing?
Hello, Ronak. I'm very good. How are you?
I'm very well. Thank you so much for asking, doctor. We're talking about steroid creams in specific today because, a lot of us use a lot of creams on our faces, on our body, and we don't know what exactly is there in it. Some of them also have steroids. So my first question to you is, what are steroid creams and, how common is it to find them in these kind of creams?
Okay, yeah. So steroid creams are basically medicated creams. They're not like normal moisturizing creams. You don't actually find them in the supermarket. They are present in the pharmacy usually. You get it from the pharmacy. So they are medicated creams. They are supposed to be on prescription creams actually. So don't get misguided by the name cream. Cream is just like a formulation to be used, but these are actually on prescription medication.
Okay. So generally you find them in what kind of creams? Like facials, moisturizing creams, or what kind of creams?
No, they're not moisturizing creams or lotion. They are medicated creams. So you go to a pharmacy, for example, and you ask like, okay, I have some rash, I have some itching or something. The pharmacist may give you. That's how they are being misused actually. They are as I'm telling, they're medications.
Okay.
Don't get misguided by the cream. Cream is just like a formulation as such.
Okay.
But they are medications.
But just for our awareness, are steroids also found in your regular over-the-counter creams that you use for daily purposes?
They should not be found actually. They should not be found. But if it's not, they are not supposed to be there in the over-the-counter products.
Okay.
They are to be dispensed only by prescription of doctors.
चलिए ओके तो ये बात तो समझ आ गई कि अगर स्टेरॉइड है तो इट हैज़ टू बी प्रिस्क्राइब्ड नाउ व्हाट डू यू मीन बाय द स्टेरॉइड क्रीम्स मिसयूज और अब्यूज
या सो बाय दैट आई मीन जैसे आपने अभी पूछा कि क्या ओवर द काउंटर प्रोडक्ट्स में भी कई बार होता है होना नहीं चाहिए बट समटाइम्स इट इज दैट फॉर एग्जाम्पल आई विल गिव यू लाइक स्टीरॉइड क्रीम जनरली हम स्किन प्रॉब्लम्स के लिए यूज करते हैं दे हेल्प इन रिड्यूसिंग द सम सिम्टम्स इन द स्किन लाइक इचिंग रेडनेस ये सब चीजें रिड्यूस करता है वो साथ में उसका एक लाइटनिंग इफेक्ट भी होता है तो इसलिए सम ऑफ द फेयरनेस क्रीम्स कैन कंटेन स्टीरॉइड्स
Okay, how do we know that they have steroids? I mean, obviously some word will be written which will definitely not be steroid. It will be something else, but it basically means the same.
See, ideally, if a steroid is there, it should be mentioned in the ingredient that it contains steroid. So you need to read the ingredients to know if it contains steroid.
Is the word steroid used in that?
There are different types of, steroids available. And they are, as I'm telling, they are not available in the supermarket. So generally, they are in the pharmacy.
हाँ नहीं
so
मतलब
how this? हाँ
आपने बोला ना कि कभी-कभी इंग्रेडिएंट्स में यूज करते हैं तो हमें कैसे पता चलेगा कि स्टेरॉइड है क्या लिखा होगा अंदर स्टेरॉइड या इज देयर एनी अदर टर्म दैट दे यूज
लिखा होना चाहिए दैट्स व्हाट आई एम ट्राइंग टू कन्वे दैट लिखा होना चाहिए पर कुछ ब्रांड्स में लिखा नहीं होता है कुछ प्रोडक्ट्स जो सही नहीं है यूज करने के लिए उसमें लिखा नहीं होता है सो दैट्स द होल आइडिया यू डोंट गो फॉर फेयरनेस क्रीम्स टू बी ऑनेस्ट दैट्स व्हाट वी से बिकॉज सम ऑफ देम कैन they can contain we don't know so if you be sure that all the ingredients are mentioned on it and they are not over the counter products like fairness creams are not supposed to use the steroids
correct but why is it demonized so much steroid exactly होता क्या है
स्टीरॉइड जैसे मैंने बताया कि मेडिकेशन होता है और ये स्किन के लिए डर्मेटोलॉजिस्ट नॉर्मली यूज करते हैं या अदर डॉक्टर्स आल्सो यूज इट एट टाइम्स इट बेसिकली रिड्यूसेस द सिम्टम्स एसोसिएटेड विद स्किन डिजीजेस जैसे रेडनेस है इचिंग है इन सब चीज़ों को रिलीव करता है तो डॉक्टर्स यूज इट टू रिलीव दो सिम्टम्स ओके नाउ अब इसका अब्यूज क्यों होता है वन इज लाइक समटाइम्स people have some skin concerns suppose and they cannot go to a doctor. So they go to a pharmacy and they say, okay, I have some itching, okay, give me some product. And then they use it. And steroids have a very dramatic effect. They use it, they feel relieved, they keep using it. So that's how the misuse happens. That's how the abuse happens.
Okay. And what are the side effects after the misuse has happened?
Yeah. सबसे important चीज ये है कि जो skin diseases के symptoms होते हैं ना, they are very non-specific. Like an infection can present as an itchy rash, allergy can present as an itchy rash. So first of all, if you just use a steroid cream by yourself without going to a doctor, you will not know what you are suffering from. So first of all, हम diagnose ही नहीं कर पाएंगे कि आपको problem क्या है, right? So the diagnosis is not there if you use a steroid cream. You use it, it gets suppressed. Then it comes again, you use it, it gets suppressed. For example, if somebody has a fungal infection, okay, it can be presenting as an itchy rash on the skin. They use a steroid cream, it gets suppressed. They keep using it, the symptoms will be suppressed, but the fungus will grow underneath the skin. So this is actually giving a problem of superbugs now. So now we have problem of resistant to, antifungal medications because of this. So actually it's a wrong treatment that you're doing because you don't know what the skin problem is. You're just trying to suppress the symptoms.
Okay.
ये एक issue ये है. और secondly, जब आप लंबा time steroid creams use करते हैं, it can have lot of side effects in the skin. For example, अगर आप steroid cream face पे use करते हैं, ठीक है? When you use it for a longer time and when you use the wrong kind of a steroid, it can give you acne. It can give you, जैसे मैंने बताया, इसका थोड़ा lightening effect होता है, तो it can give you a patchy lightening effect on the face. It can make your skin very sensitive. It can increase the hair growth. It can thin out the skin. So all these side effects
which
are bound to happen.
Right. And when you're using them, you don't realize because your problem is getting solved in a very temporary, superficial manner. But inside your body, it's causing all these long-term problems. Exactly.
And some of them are like really serious side effects. Like when you use the steroids on the body fold areas where the skin is thin, you can get very broad stretch marks. They are so very difficult to treat later on.
Right. Okay. So इनके side effects को भी फिर बाद में इनको cure करना भी is a challenge, right? You're saying?
Of course. Right. Yes, it is.
Okay. Thank you so much, doctor, for joining us. We hope that the listeners get the message that especially when it comes to skin problems, if they are having any issues, the best is to see a dermatologist and then treat it as per the prescription that the dermatologist gives, rather than just going across to a pharmacy and self-treating yourself, right?
Exactly. You got it right.
All right. Thank you so much, doctor, for joining us today.
Thank you, Ronak. Bye-bye.
Bye.
This is Life Talk with Ronak Kotecha. Talk 100.3.
Another one down.
Will you be on the winning side? Make a guess and score big. Get ready to swing into action of every game of the Tata IPL Predict and Win the Golden Bat.